When I initially started my career, it was after a pharmacy residency, and I really wanted to make sure that I was doing something clinical. I did start my career really in a hospital, and getting to know some of the, we had a wing that was really just simply for patients with cancer. And they had I wouldn't really say it was a developed palliative care program, but they certainly had symptom management and pain management. I was really interested in that. My career was really a little bit more removed, even though I was talking with nurses on the phone. It wasn't direct patient care. So I wanted to be able to interact with more folks. So not just the nurses that I was interacting with every day, but also social workers and physicians and chaplains and other folks that were there to support hospice and palliative care, and really learned from them, because I wasn't getting that type of experience through just working. The program itself connected me with what the folks that I wanted to connect with, the physicians, still with the nurses as well that I work with every day, but with social workers, chaplains, even administrative assistants that wanted to understand more about hospice and palliative care, being able to connect with them on a daily basis, interact with them, work with them on teams and kind of do mock IDT meetings. That was fun. Another thing about the course that I really loved was, and probably one of my more favorite things, is doing the reflective pieces. We had to submit a reflective piece about, reflect on the past week. What have you learned? How have you grown? And that really allowed me to kind of think about how much this program meant to me, and how much I was actually implementing every day, even while I was still in the program in my everyday work. The things that I want to take forward, I've already taken forward, just being 2 years since I graduated from the program. The things that I take away and working with is bringing those concepts into the work that I do. So at this, right now I work with training new pharmacists that come in and work with our company, and also enriching them. So I get them ready to be on the phones doing those consults and taking those hospice type of orders, but then I also need to review literature and understand the literature, be able to interpret it so that we can utilize that for enriching our pharmacists so that they end up being the best of the best going forward. Some of the things that I'm looking for the future, things that I haven't been able to implement yet, but are still right there at the top of my list, is to be able to do research with the data that we have. And Clara Pharmacia has been a company that's been around for quite some time, and there is a lot of patient data there. And I want to be able to publish literature that allows folks to really understand some of the prescribing practices of hospice physicians and how we can improve those and how we can learn from them. So everybody that's involved in taking care of that hospice or palliative care patient, if you want to learn from them, understand their perspectives, and be able to take those perspectives away with you and apply them to your practice, this is the program for you.